Hey, welcome. So today we're going to dig into a story that all comes down to two little words: low risk. For millions of parents to be, hearing those words is this huge sigh of relief. But what if that relief is actually based on a pretty big misunderstanding? We're going to look at a real-life case where low risk led to a total shock, and in the process, we'll uncover why the stats behind these prenatal tests aren't nearly as black and white as you might think. And it all kicks off with this headline. I mean, you can imagine this sent shockwaves through a lot of communities. A family who did everything right, who got that reassuring test result, had their entire world turned upside down. This isn't just clickbait, it's a real story that makes you stop and ask, do we actually understand the tests we put so much faith in? And yeah, that's the big question, right? The one at the very heart of what we're talking about today. How can a test that's famous for its accuracy give a low-risk result, and then the exact thing it was screening for happens anyway? To get to the bottom of it, we've got to go way beyond the headline, look at the actual science, and honestly, bust a pretty critical medical myth. All right, let's get into the specifics of this case. It was reported by Mirror Weekly, and it's about a woman in Kaohsiung. Now, after years of trying to conceive, she finally got pregnant. And during her pregnancy, she did what many expectant mothers do. She took a non-invasive prenatal test, an NIPT. The results came back with those magic words: low risk. And this is really where the confusion starts to set in. You see, the NIPT is often advertised as having a detection rate of over 99% for Down syndrome. Now, to you and me, a number that high, it just sounds like a sure thing. It feels like a guarantee, right? But as we're about to find out, in the world of medical statistics, 99 point something percent means something very, very different. So, to really solve this puzzle, we have to get one thing straight. It's a fundamental distinction in medicine that is just absolutely essential to understand. It's the difference between two totally different types of tests, two separate roads to getting information. One is called screening, and the other is called diagnosis. And you can see the difference right here. On the left, you've got a screening test like the NIPT. Think of it like a weather forecast, a really, really sophisticated one. It's non-invasive, just uses mom's blood, and it gives you a statistical probability, an assessment of risk. But on the right, you have a diagnostic test, like an amniocentesis. This isn't a forecast. This tells you if it's raining right now. It provides a definitive answer. It's more invasive, sure, but it looks at the baby's actual cells to tell you for sure. So screening suggests a possibility. Diagnosis confirms a reality. Okay, so if the NIPT is just a risk calculator, how does it actually do the math? How on earth can it get a glimpse of a baby's genetic code from just a sample of the mother's blood? It sounds kind of like science fiction, doesn't it? Well, let's pull back the curtain and see how this incredible science actually works. The secret sauce here is something called cell-free fetal DNA. It's pretty amazing. As a baby develops, the placenta actually sheds these tiny broken up fragments of the baby's DNA, and they end up floating around in the mother's bloodstream. Now, it's not a lot. It only makes up about 10% of all the free-floating DNA in her blood, but it's enough for scientists to find and analyze. It's like this incredible biological backdoor that gives us a peek at the baby's genetics. Now, the process in the lab is super complex, but we can break it down into four main steps. First, it starts simple, with a regular blood draw from the mom's arm. Then, in the lab, they spin that blood down to separate the plasma and pull out all those little floating DNA fragments we talked about. After that, these super powerful machines sequence the DNA, which is just a fancy way of saying they read the genetic code. And finally, and this is the absolute key, they count. They literally just count how many of those DNA fragments belong to each chromosome, with a special focus on chromosome 21, which is the one linked to Down syndrome. All right, so the lab has its count. But a number is just a number, right? How does that raw count get translated into high risk or low risk? This is where the biology meets the math. And to get it, we need to talk about a concept called the Z-score. Don't let the name intimidate you. A Z-score is really just a statistical ruler. Its whole job is to measure how far away from normal a particular number is. In our case, it takes that count of chromosome 21 DNA and asks a simple question. Is this amount what we'd expect to see in an average pregnancy, or is it statistically weird? Is it an outlier? And these are the actual numbers that make up that ruler. See, based on data from thousands and thousands of pregnancies, scientists know that the average amount of chromosome 21 DNA should be about 1.3%. They also have a number for the standard deviation, which is basically just the normal wiggle room around that average. Using these, they draw a very precise line in the sand. If your result gives a Z-score of 3 or more, it gets flagged as high risk.
Now this slide really shows you just how razor thin that line is. Check out these two hypothetical examples. Mrs. Lynn's test finds a chromosome 21 level of 0.01440. Her z-score works out to 2.8. Her result, low risk. Now look at Mrs. Chen. Her test value is just an invisibly small fraction higher at 0.01450, but that tiny difference is enough to push her z-score to exactly 3.0. Her result, high risk. Two completely different worlds based on a statistical difference you could barely even measure.
So let that sink in for a minute. What this really means is that the difference between a result that brings total peace of mind and one that causes incredible worry can literally come down to the machine detecting one single extra fragment of DNA in a sample of 10,000. It's not finding a yes or a no. It's detecting a faint statistical signal that pushes the result over a pre-programmed threshold. So let's pull all of this together. We've looked at the science, the statistics, the real-world story. What is the single most important lesson that we can take away from all of this? It really boils down to these key points. Number one, and say it with me, a screening test is about probability. It is not a diagnosis. And that leads directly to number two. Low risk does not mean no risk. It can't. It just means the chance is very, very small, but it's never zero. Third, a test result like this isn't the final word. It's the start of a conversation with your doctor. And finally, always remember that there are other options, like diagnostic tests for anyone who needs or wants that definitive, certain answer.
So when you look back at that original headline, you realize it wasn't really a failure of the science itself, but a failure in understanding what the science was actually telling us. And that leaves us with a much bigger question, one that applies to so much of our lives now. In this age of data where an algorithm can calculate our odds for almost anything, what does it really mean to be at risk? And how do we, as humans, learn to make deeply personal decisions based on the cold, hard lines of statistics? It's definitely something to think about. Thanks for digging into this with me.